If you want to weigh up the effect of social work practices and make them visible, this must be done intelligently, with an eye to the context in which these practices develop. We therefore need a model that responds to this complexity. The American Indian professor, Alnur Ibrahim, has developed such a model to measure social change. A first type are niche interventions. The short-term effect of these interventions, the outputs, is clear and predictable. The longer-term outcomes are much less predictable. Take the introduction of ambulances. These ambulances try to reach a scene quickly with an emergency doctor on board. In the short term, this intervention can make the difference between life and death. But apart from transport, first aid and information gathering, the organization has little influence or control over the future health of the patient, let alone the mortality rate in a region. This is also the case with crisis care. In often difficult circumstances, interventions are made that one can know with some certainty will have the intended effect in the short term. For example, protection from deprivation or restoring calm in a highly stressful situation. But how the client situation subsequently evolves is largely beyond the control of the crisis relief workers. It is therefore difficult to expect niche interventions to make long-term outcomes visible and accountable. This is not to say that they should not capture impact. On the contrary, the outputs of these interventions can be visualized transparently. Does this intervention achieve a faster response time? Are we reaching new target groups? Are the care recipients satisfied? It is perfectly possible to standardize these impact measurements or to carry them out according to a fixed pattern. Also, with the second type, integrated interventions, you are quite certain about the relationship between cause and effect. You can estimate in advance whether the intervention will have results. Moreover, with these interventions, there is more control over the outcomes in the longer term. These integrated interventions are often organized on the basis of the chain principle. Through serial switching of interventions, one tries to achieve a higher degree of control over a process in which different factors play a role. Think, for example, of activation programs for people who are largely outside the labor market. We know that a combination of guidance, training, and education can make a difference. One of these interventions in itself is often not enough to get a job. Here, standardized, quantifiable indicators can show the effect of these interventions. In this way, you can measure whether or not someone is employed in the regular labor market. Of course, this never tells the full story. If you also want to capture whether people are permanently employed or have better future perspectives because of their job, you need additional, often qualitative information. Looking for information from both qualitative and quantitative research is therefore advisable. There is great uncertainty about causal relationships and limited control over outcomes in emergent interventions. Organizations aimed at influencing policy are a good example. It is often difficult to know in advance which attempts at influencing policy will work. Moreover, these organizations have little control over the effective outcomes of their work. For example, even if you succeed in getting a bill on working conditions passed, organizations cannot guarantee that this will effectively lead to a less exploitation and accidents. Another example is services that offer generalist counseling to vulnerable target groups, such as district teams. These social professionals is tailored to various needs in many problem areas. The same approach will work better for one client than for another. The situations are so complex that it is impossible to predict how the generalist has contributed to a particular result. It is therefore difficult to determine in advance what the best strategy or course of action will be. For one client, a successful outcome will be obtaining a living wage. For another client, independently mapping out the route and taking the bus from point A to point B will already be a significant achievement. Rather than talking about results in terms of outputs or outcomes, the impact of this type of intervention is best understood in terms of influence. In what way do these interventions contribute to a change? A final type of intervention, ecosystem interventions. Here, organizations try to coordinate better different interventions in order to achieve better outcomes in a complex context in a new way. Examples include innovative attempts to organize network building assistance and services based on different actors fighting homelessness, such as Miriam's Kitchen in the United States or Housing First in Finland. To tackle a problem, ecosystem interventions fundamentally redraw the relationship between different actors. The orchestration of an innovative structural approach is best started from a shared value framework and an in-depth analysis of the context in which you are striving for change. In this setting, it is difficult to attribute successes to individual members of the system. For the organizations involved, it is important that they make it visible how they coordinate interventions through collaboration. In doing so, they can develop a theory of change that takes into account the interdependence of the actors involved who are working together towards a shared end goal. That end goal is clearly defined in terms of observable, individual, or societal outcomes.